everybody. Good afternoon. My name is Patricia McCoy, and as many of you know, I am the faculty director of the Rappaport Center for Law and Public Policy. I'd like to welcome you to today's panel, which is a passion project of mine. I'm very excited for it, called When the Feds Drop the Ball, State Innovations in Health and Climate Policy. As you probably know, last year's presidential inauguration ushered in radical changes in federal policy. In some cases, federal health and safety initiatives that the nation had depended on for years were vacated or reversed. That included federal systems to counteract climate change and for the approval of vaccines. Although these federal regulatory schemes were dismantled, the underlying problems did not go away. People still need vaccines, and climate change remains a threat. Accordingly, many states have responded with bold action to provide the essential oversight that the federal government no longer offers. In our panel today, three distinguished officials from our own Massachusetts state government will describe some of their innovative responses to the regulatory vacuum in Washington. They include Commissioner of Insurance, Michael Caljo, who also happens to head the Rappaport Center's Advisory Board, Commissioner of Public Health, Robbie Goldstein, and Climate Chief Melissa Hocker. To have one leading official here is always an occasion. To have all three is the deepest honor, so thank you so much for coming. Our panel will be moderated by BC Law professors Carolyn Cox and Dean Hashimoto. Professor Hashimoto is not only a law professor, he is also a visiting professor of medicine at Harvard Medical School and the physician overseeing the workplace health and safety of the 80,000 healthcare employees of the Mass General Brigham. He led the effort to require and provide COVID and flu vaccines for MGB employees during the COVID pandemic and provided consultation to its health insurance plan. He is the chair of the Medical Advisory Board for the state's Workers' Compensation Agency and advises on medical utilization policy issues. Let me also mention that he wrote one of the leading books on COVID prevention called The Case for Masks. I commend it to you. Professor Carolyn Cox studies the roles that state and local governments play in environmental governance and federalism in the climate change era. She received her JD from Harvard Law School and previously was the program director for the Energy, Environment, and Land Use Program and an adjunct faculty member at Vanderbilt Law School. She also worked as an associate attorney at the Environmental Law and Policy Center of the Midwest, where she worked on matters before the Public Utilities Commission of Ohio, promoting the clean energy transition in Ohio, and assisting with environmental litigation and state and federal courts. Before I forget, let me mention that today's event is being recorded. And with that, I turn the panel over to Professor Hashimoto to introduce our distinguished speakers. Thank you.
Thank you, Pat. It is incredible that we have with us today this panel who are not only leaders in the state, but really are at the cutting edge nationally on probably the most important issues of our day, issues involving health insurance, public health, and climate change. Let me just give a brief introduction to each of our panelists. Attorney Michael Caljo is the Commissioner of Insurance for Massachusetts. As Commissioner, he oversees the state insurance market, an approximately $70 billion industry that historically ranks near the top 10 largest markets in the country and 27th globally. Prior to this role, he directed Blue Cross Blue Shield of Massachusetts regulatory and policy portfolio, supervising their contracts division, and ensuring compliance of laws and regulations. Previously, he spent a decade in state government, serving as general counsel to the Massachusetts Division of Insurance as deputy director, general counsel, and chief of staff for the Office of Consumer Affairs and Business Regulation. Michael chairs the board of advisors out of the Rappaport Center. Thank you so much, Michael, for coming. Dr. Robbie Goldstein is the commissioner of the Massachusetts Department of Public Health, overseeing and addressing a number of issues, including environmental health, infectious disease, maternal and child health, injury prevention, several important state public health hospitals, and the State Public Health Laboratory. Previously, he served as senior policy advisor at the CDC, where he focused on public health emergency response, infectious diseases, and the CDC's strategic policy initiatives. Dr. Goldstein also served as medical director and founder of the MGH Transgender Health Program. Thanks, Robbie. Finally, attorney Melissa Hoffer is Massachusetts' inaugural climate chief, the first role of its kind in the country. Prior to entering state government, she served as acting general counsel and principal deputy general counsel of the federal EPA under President Biden. She also worked in the Massachusetts Attorney General's office in a variety of roles, including as chief of Energy and Environmental Bureau. There she led the office's litigation against ExxonMobil for deceiving Massachusetts investors and consumers about the risk that climate change poses to Exxon's business and global financial markets, and the impacts of the fossil fuel products on climate changes. She also held senior roles at the Conservation Law Foundation and practiced for many years as a litigator and environmental lawyer at WilmerHale. Thank you. Thank you so much, Melissa, for coming. Caroline?
I'll just reiterate our gratitude to the panelists for being here today. I want to offer just a little more background before we dive into our conversation. As Professor McCoy mentioned in her introduction, over the last year, we've seen the federal government step back on its prior leadership on public health, health insurance, and climate change policy. For example, under the oversight of RFK Jr., the CDC has dramatically changed its vaccine recommendations, and its vaccine advisory board now includes members that have expressed concerns about the safety and efficacy of vaccines. As for insurance, the Trump administration has sharply limited the federal subsidization of the Medicaid expansion under the Affordable Care Act, which is estimated to mean 10 million fewer Americans will have Medicaid coverage. On climate change, the administration has paused and in some cases tried to claw back climate change funding under the Inflation Reduction Act. In addition to withdrawing from the Paris Climate Agreement and the UN Framework Convention on Climate Change, the Trump administration has also rescinded the endangerment finding, which is the foundation for all federal regulation on greenhouse gases under the Clean Air Act. So this is a challenging time, but there is a lot of state innovation happening, and I'll turn it back over for the first question so that we can hear from our panelists.
Maybe we should have them go through their specific. We'd like each of the panelists, just in order to inform us all, and give examples of the state initiatives that they've been involved with to help fill in this gap that has been left as a result of these federal actions. Michael Kelcher, would you like to begin?
Thanks very much, and thank you to BC Law School and the Rappaport Center for having us here today. I feel like this group could roll out of bed and talk about this topic, and we live it every day. I'm really proud to be on this panel with Commissioner Goldstein and Chief Hoffer. Our work at the Division of Insurance has been in tandem with them on a number of different climate climate change and, for example, vaccine policy. So I won't talk about those. But what I would do is give you a little snapshot of kind of the mindset of how we have engaged on the problem of federal obligations not being met and how states can work around those issues and continue to drive to reform. First of all, I think it really is dependent on people. So bringing in teammates and working with folks who are dedicated to the task, notwithstanding the challenges that are out there. That means really just diving into the weeds, getting information about how states can interact on the different topics. The Division of Insurance is the primary regulator of insurance across each of the states. So in addition to life insurance or property and casualty or auto insurance, we also regulate health insurance. That means we regulate and monitor market conduct in those areas, making sure the insurance companies abide by the laws and regulations, that they have the financial solvency to be able to pay claims when they come due, and that consumers get a fair deal when they purchase insurance. And I would just dive into the affordability challenges that are first and foremost in all those lines, but with specificity to health insurance. Affordability is now more out of reach than ever for the everyday consumer. And the Healy-Driscoll administration and our team at the DOI has been really dedicated at diving into what that means and how we can help people. So, for example, part of your health insurance is your deductible amount and your cost share, your copay, when you go see a doctor. States have never regulated deductible amounts, ever. We did. Last year, we told the insurance companies that they were not allowed to raise deductible amounts by more than 4.8%. This year, it will be 3.6%. That's meaningful to people because it puts essentially the insurers on the same diet that you and I have to be on when we pay our own bills. Secondly, we took a look at the premium amounts that folks were being paid. And we're seeing premium amounts of, in some cases, 15 to 20% increases year over year. That's not okay. And so we hire actuarial experts to go through each of the filings and pare back and question assumptions. It's hard. It's painstaking work. It can be disruptive. The insurance companies oftentimes do not love the scrutiny, but it makes a difference to the insurer buying public, not just individuals, but companies that are offering insurance to their employees. Health insurance is a benefit design. We're fortunate in the sense that it's not a individual responsibility in many cases, that your employer will pick it up as a cost. And so it's driving out jobs, it's driving out budget allotments at municipalities for teachers and firefighters, so the work we're doing is meaningful. It's also not happening at the federal level. And so those are good examples of how every day we're calling attention to issues that the feds have not ever paid attention to and probably never will.
Dr. Robbie Goldstein?
Great. I guess I could say, I could give you an example of almost every day over the past year where we have had to push back against the federal government or respond to an absence of action from the federal government. But perhaps it's no more apparent than in our work in vaccines. I think folks likely know that there has been a real assault on vaccines and vaccine policy by the Trump administration led by Secretary Kennedy. And it has been our responsibility in Massachusetts to step up and to respond to that assault. The work I could describe best as untangling a very complicated knot. Vaccine policy in this country for decades, for really over 50 years, had been an interconnected process between the federal government and state governments. The federal government, through the Advisory Committee on Immunization Practices out of CDC, and also out of advisory committees through FDA, would put out recommendations of what vaccines were appropriate for various age groups, various groups of people at risk. And really, for decades, those recommendations aligned with the science that was available. Usually, they were endorsed by the American Academy of Pediatrics, by the American College of Physicians, by the Infectious Disease Society of America, by all of the professionals working out in the field who were reviewing the data and in many cases producing the data that informed the recommendations. But under the Trump administration, we saw very early on that the advisory committees, in particular the Advisory Committee on Immunization Practices, were being dismantled. They were being, membership was being replaced with individuals who no longer believed in the science and in the evidence behind vaccine policy, but instead were using ideology to drive decisions. We also saw an abdication of responsibility to even meet. So the Advisory Committee on Immunization Practices during my tenure at CDC met routinely 3 times a year, but during times of significant vaccine policy work would meet as frequently as monthly. So if we think during the COVID pandemic, we were having advisory committee meetings every month to talk about vaccine effectiveness and vaccine recommendations. Under the Trump administration, the Advisory Committee on Immunization Practices has repeatedly canceled their meetings. And when they have had meetings, they have changed the agendas at the last minute, oftentimes removing important presentations on data. The normal flow would be that those recommendations, the data and then those recommendations, would go to states. And it's in the states where there's the responsibility to regulate vaccines. So it's up to states to decide what are school entry requirements for vaccines. It's up to states to decide how do you incorporate those vaccine recommendations into your policies, into your guidelines. We had always pointed directly to ACIP, and we could no longer do that. And so to untangle the web, we had to set up a series of new policies, new regulations, and new advisory committees to help us move forward with evidence-based vaccine policy. We did some of that with the Division of Insurance, where we asked that insurers look to the Department of Public Health, not CDC and its advisory committee, to understand what vaccines should be recommended. We did that through professional boards, where we gave pharmacists the ability to vaccinate individuals with DPH-recommended vaccines and not federally recommended vaccines. And we worked with membership of senior advisors from across Massachusetts, expert clinicians, researchers, so that we could put out our own evidence-based recommendations. We did that collaboratively with the American Academy of Pediatrics. We also had to look beyond Massachusetts, so beyond what was under our regulatory control and what we could do here. And we formed a collaborative with states across New England that expanded to states across the Northeast and has subsequently expanded to states all the way down to the Mid-Atlantic. And the power of us coming together cannot be understated. We are a group of states that are red and blue and purple. We have Republican governors and Democratic governors, but we have a shared understanding that we will let data and evidence drive our decisions on vaccine policy. And collaboratively, we came out with recommendations and how we would implement those recommendations within each of our jurisdictions. And it's meant that now, whether you are living in Maine or down in Virginia, you know that you're going to be covered by the same vaccine recommendations, and you can feel comfortable and hopefully safe that the public health will be protected during or across that wide swath of America.
Melissa Hoffer.
Great, thanks. Well, let's begin by thanking Boston College and the Rappaport Center for having us here. It's a really, really important conversation, and I'm so grateful for my colleagues with whom I work very closely. I think I'm going to start by telling you a little bit about that. So with Governor Healey's first day in office, she issued Executive Order 604. I recommend you to read it. And it established the first Office of Climate Innovation and Resilience at the cabinet level in the country. So I'm the first cabinet level official to work on it in a state governor's cabinet. And my task was really to inject climate change into the DNA of all of the other executive branch secretariats. There are a total of 11 of them. So I work closely with all of those secretaries and with the leaders of the agencies that are part of those secretariats. And the reason why is if you have any sort of orientation to how climate change has been dealt with in the past, you probably know that it has largely been within the purview of energy environmental agencies, whether that is at the Environmental Protection Agency or whether it was at FERC or here in our state with DEP and our State Department of Public Utilities. And that's just too much climate change for too few agencies. Because what we do know is that it touches on everything: transportation, housing, health, insurance, huge issues, right? And so we need to be thinking about climate change when we're thinking about the policies that are emerging from all parts of state government. That is also true of federal government. This role was modeled loosely on President Biden's first Office of Domestic Climate Policy, which was headed by the legendary Gina McCarthy, who used to be the administrator of EPA and held many other roles under both Democratic and Republican governors in New England. So really important that we start thinking about the impacts of climate change across the board. Before I tell you what I've been working on with our teams across state government, I just want to kind of level set a little bit about climate change because it can be such a despairing, and is, in fact, a really pressing and difficult issue to think about as we see it unfolding around the world and we see the impacts here in our own backyards. So just to give you a sense, you may have followed this Potsdam study. It came out about two years or so ago. It was published in Nature, about $38 trillion annually, just globally, responding to the impacts of climate change. That's not mitigation. That's just like dealing with the mess and the disasters that climate change is going to cause. That article was ultimately withdrawn from Nature. They went back to do their calculations. There was some concern about whether their modeling was actually, because the numbers are so big. And in fact, they are confirming those. So it will be, I expect, republished in Nature again soon. Meanwhile, there's been a meta-analysis of those figures that was conducted by a guy named Al McGartland, whom you guys might know. Al's sort of the dean of environmental economics and long-standing lead of the Office of Policy at EPA. So these are really solid numbers, and it's like almost, right, you can't even think of how big $38 trillion is. But one way you can think about it is if you have like a basic concept of GDP, you could see where you would still have pretty high GDP because you're spending a lot of money to respond to disasters. But what you will not have is wealth accumulation. What you will see is impacts on job creation. What you will see are large losses of wealth across the board because we're spending the money responding to climate change. So that's sort of one way to really think about the grid. It is roughly 1 billion climate refugees by 2050. That's just 25 years from now. And you can see we don't already do a very good job with how we're managing the high levels of migration that are occurring, driven in part by climate change. That is certainly the case for Central and South America. So here in our own backyard, I spent this past year going around to different communities in Massachusetts, just hearing from people. We just organized community events where people in that community could talk to other people in that community about the climate change experiences they're already having. So we have heard about farmers who are losing crops. We have heard about third-generation lobstermen who cannot find lobsters here anymore because the water is too warm. We have heard from the difficulty that our shellfish farmers currently are having down on the Cape because of the northward migration of green crabs. We have heard about health concerns. We have heard from firefighters. We have heard from DPW workers. Like, this is a problem that is happening now, and it's costing us a lot of money. Now, it is in fact costing about $1 trillion annually, just in the United States, again, just responding to the impacts of climate change, and that number is from Bloomberg. It came out about 10 months ago. So that's just a level set. Now, that's the despairing part. Okay, the good news is that the clean energy transition, I come from Pennsylvania, we have a saying, the horse is out of the barn. It is genuinely out of the barn. Why is that? Why is it? Anybody have a guess? Why are we moving away from fossil fuels now very fast at a global level?
Running out of gas.
We're not running out of gas. That's a good guess, though. What else?
Cheaper.
It's cheaper. And it's like a lot cheaper, right? So if you look at 2024, solar PV, on average, 41% cheaper than comparable fossil fuel projects. The wind's coming in at about 53% cheaper. And last year was an incredibly important year for planet Earth because what happened, does anybody know for the first time in the history of the planet what occurred? We have more power come from renewables than from coal. So that's our trajectory. We're moving there. We see countries like China, lots of accord happening between the EU and China, between the EU, China, and India. That's where we're going. It's a huge moneymaker. Lots of people are making lots of money in the climate tech space right now, even here in Massachusetts. So a big part of what we do, what you're going to hear me talk about, I will just spend a few minutes on a couple of sort of marquee things that we've been working on, is sending a market signal. So when you think about the endangerment finding, for example, that we heard about Caroline, the endangerment finding is sort of like pivotal basis. But by the way, recall, endangerment finding, another thing brought to you by Massachusetts, because it was the product of Mass versus EPA, which is a litigation that went all the way up to the Supreme Court. If you haven't listened to the oral argument in that case, I recommend it to you, in which case there's this fabulous colloquy from Jim Milkey, who was in the Office of the Attorney General at that time, with Justice Scalia, about how to discuss where the impacts of climate pollutants, whether it was on the stratosphere or the troposphere. So it just makes you so damn proud of Massachusetts. And that case concluded that EPA can, in fact, regulate the 6 greenhouse gases as long as it finds that they endanger human health and welfare, which of course it did approximately 18 years ago. Carolyn will correct me on that. So that's a long-standing rule. But what did it do? It sent a market signal. Because what did we do with it? We regulated tailpipe emissions on the basis of it, and then we regulated stationary sources, which is just a fancy word for power plants. So those market signals are really what begin to push technology. They're what we call technology forcing market signals. So that's really what we're trying to do to fill the gap here. We try to keep things moving along. One reason why states collectively, and even the federal government, lag, because we know what to do about climate change, right? That's not hard. That's really easy if you just step back from it and don't listen to all the mishegas that you hear from vested interests. You know that we need to get away from fossil fuels. Fossil fuels are dirty fuels. They have terrible public health impacts. They are causing damage that is becoming uninsurable. That's what we need to do. To do that, though, you need to align your policy with a budget. And that hasn't always happened across the board. So you saw the Biden administration really try to do that with the Inflation Reduction Act, where you're trying to marry private sector incentives with what the government itself is going to do to help us transition as quickly as possible away from fossil fuels and to clean energy sources. So when that money goes away, or it's being litigated and clawed back, one thing that we have really tried to do, and we came in with this focus, but believe me, it is now about 85% of my job, is to find other ways to finance the transition. And that means states have to think very differently. States are really used to giving money away. You know, if you kind of think at a very high level, what do? We convene people, we regulate, that's the part people don't like. You know, we give money away, okay? So we can't do that so much anymore. We're always going to give grants, but we have to start thinking more along the lines of finance, where we can be doing things like revolving loans. I'll explain some of these things, bridge loans, other ways to stretch the dollars. Basically, it's a way of using the same dollar over and over again. So 2 quick examples, and I'm sure we'll get into more of the detail. The first thing the governor did in this space was put a climate bank in place. We didn't have one. Our next door neighbor in Connecticut has one of the most effective, longest standing climate banks in the country. So we did the Massachusetts Community Climate Bank. And the cool thing about it, we kept it focused solely on decarbonizing affordable housing. Because decarbonizing affordable housing is one of the toughest nuts to crack. People perceive creditworthiness issues and the likes. So we put it there at Mass Housing, that has 30 years of experience with complex financing deals. And now that bank is returning dividends. It is getting in excess of 54% average reductions in energy use. And the best part is, the reason why it's so successful is that unlike other state programs, the folks in that program will actually hold your hand if you're a homeowner, walk you through every step, give you a lifetime decarbonization policy for your home, and then help you put the financing together. These are very low interest loans, and when the money gets paid back, it goes into the same revolving fund that can help someone else with their home decarbonization. We did something similar with impact investment. There's a firm called Social Finance in Cambridge, run by Tracy Blangen, and social finance does impact investing. So we put together a fund with them. It's a $10 million fund. We put in $5 million. They put in $5 million. And what we do with that money is help remove barriers for folks who want to either get trained for clean energy jobs or upskill. We have great training programs. Governor Healy has made most of those tuition-free at this point, but it's still really hard. If you think about people who don't have a car, maybe they don't have first and last month's rent, or they don't have a laptop, or maybe they have a kid and they can't go and take the classes. So this money allows you to do those things. You do pay it back. It's interest-free, and you pay it back once you're out in the working world. You're making $47,000 a year. That way, again, you start to see the idea. We get to use that dollar over and over to help other people. So I'm going to stop there. I could go on and on with other stuff we're doing, but I wanted to focus particularly on finance at the outset because that is really where we need to close the gap. And of course, we can never fully close the gap with federal dollars, but what we are also doing is trying to bring philanthropy on board to begin to see some of these same tools could be applied there, and also working a lot with our corporate partners.
So returning back to Commissioner Caljo, you gave a number of excellent examples of activity involving the state health insurance program. I guess the question that I have is looking more at the longer term and understanding that, in the past 15 years or so, the preeminent role of the federal government through the Affordable Care Act, in terms of providing health insurance to those who need it. Is there a long-term strategy in terms of state involvement in health insurance? Are there long-term ways to answer the affordability issue, which has become, obviously, the central issue of the day?
Thank you, Dean. And you can see from the last two answers why how excited I am to work with both Chief Hoffer and Commissioner Goldstein. Before I get into the detail, I just need to do an unabashed commercial for state policy development and the role that you can play when you are in the weeds on state policy. The discussion that we're having today marries real movement on issues with the ability to actually get things done. And it's really important to keep that in mind, especially at a time when we kind of all feel a little powerless, don't we? There's this feeling like you can't really make a difference, or you're just watching the news go by and you're like, that's concerning, but I don't know what to do about that. At the state level, I can tell you, after having worked in the private sector for 20 years, you get to be a mechanic, a policy mechanic in the weeds. And it's really not just important to do, but fulfilling. And I would urge you all to continue down that path. Thank you for sharing your lunchtime with us. And I hope that you continue to poke at this and prod at it, because the more smart people that we can get involved in terms of this problem solving, the better off we're going to be. The Rappaport Center is dedicated to this task. It's dedicated to state and local leadership, and I think it's a great example of making a difference, particularly now when there's a default of the obligations. And that's not a partisan issue, it's a simple fact that it's not happening. Turning to healthcare affordability and the long-term nature of it, I think it's an open slate. Federal government certainly is not going to solve the affordability of healthcare. Right now making it worse by defunding programs across the country that are meaningful public health investments that keep people healthy or keep people out of hospitals. I think there's this myth that if you defund programs, suddenly you're going to be able to save money. People are still going to go to the hospital. And that is not good for you, me, or anyone in our community to have emergency care be the first point of relief. So I want to talk to you a little bit about the cost share work that we did, the $140 million in premium review that we did last summer that we will do again this year, and that will be an annual event now. But long term, I want to talk to you about the 3 Ps. First of all, primary care. We have to change the way that we pay for and incent people to go see their primary care doctor. When's the last time you actually got to see your primary care doctor without a struggle? When was the last time primary care doctors were incented to grow their practice by large systems? We have a crisis in primary care, not just in Massachusetts, but in America. And I think there's a high value to getting people in to see their doctor. In fact, growing the role of nurse practitioners, for example, within those practices. But getting people in to see their doctor on a usual and customary basis so that they don't just show up after they're sick. That's everyone, not just people that can afford to do it, but every single part of our Commonwealth, every resident here should be able to see a doctor when they need to see it. How do you do that? I think you have to change the way that you pay for that care. The current system is not working. We disinvest from primary care because it doesn't make the healthcare system money. Plain and simple. Specialty care makes more money than primary care. So I think we have to flip that dynamic and figure out a way to reinvest and make sure that the dollar flow goes to primary care doctors and their practices for actual medical care. I'm part of a task force that Governor Keeley crafted that has, there's a theme here about action. I think you're kind of picking up, and the governor has been great about just incenting people to tackle a problem and get out of the way. Answer it and move on to the next set of issues. That task force this spring is going to issue recommendations on changing how we pay for primary care. And I'm really excited about what it will do for the overall system. It will be complicated, it will be hard. Change is always hard, and we'll tackle it and we'll get it done. Number two, the second P, prior authorization. So, you get to see your doctor and then you have to wait for the approval to get the care that you need. We have to make it easier for people, take the obstacles out of the way towards the receipt of the care when you need it. So our Division of Insurance, I'm really proud to say, is just about finished with the issuance of final regulations on reform of the primary care system, the prior authorization system, in Massachusetts. Prior authorization is when you go to see a doctor or want a drug, and the insurance company tells you, wait a minute, we want to ask some questions, figure out if it makes sense for you or not. There are times when that's valuable. There are times when it has absolutely no value at all. And so our goal, through these regulations, is to tell the insurance companies there are a number of areas where you have to get out of the way. You're no longer allowed to ask those questions. Number two, there's a number of issues where you already have an authorization. It should continue. So you don't have to every year go through that process. Again, that will also have the benefit of taking costs out of the system because you have a whole cadre of people at the insurance company, at the hospital, at the health center that are just there to process prior authorizations. Instead, that time could be spent, that resources could be spent on care delivery and not on administrative waste. Lastly, performance, the last P. This is going to take a lot more time, but we have to pay for performance over time, not volume of care. Our current healthcare system, and this is across the country, and so this is going to be a massive issue for us to tackle in Massachusetts, but we can do it, I think, as a community. We have to make sure that our Massachusetts state government and our commercial payers pay for value, for performance, and not for volume, right? A health center, a community health center, or a Beth Israel lady shouldn't be paid just to fill up the beds that they have, right? They should get paid to keep people healthy so that they keep people out of the hospital. So building off of some contract models that already exist that pay for performance, we need to put that, for want of a better word, on steroids and get it done. Now, that'll take years to move, but if we can fundamentally transform to a value-based contract design, we will really be fulfilling the promise on affordability.
Thank you so much. And I'll turn to Chief Hopper. An interesting thing in the climate space has been that not only do we see federal backtracking, but we also see federal opposition to what states are doing. So President Trump issued an executive order last year protecting American energy from state overreach. accused states of enacting unconstitutional climate change and energy policies. The Attorney General was tasked with investigating these, there have been lawsuits filed. I'm curious, how has Massachusetts reacted and how is that affecting your work, particularly as you try to collaborate on what is ultimately a global but also a regional issue?
Thank you. Yeah, so this is a really important issue if you haven't been tracking this one, because everything that we're talking about in the climate space today does rely on our state authority. We have a State Global Warming Solutions Act that's been in effect since 2008. It was amended in 2021 to actually get us a net zero by 2050 goal. We have a Green Communities Act. We have a number of different clean energy regulatory provisions. So that's all on an architecture of state law. So this executive order that was issued by the Trump administration about a year ago directed Attorney General Bondi to evaluate all of those state climate laws, essentially for this vague test of like burdensomeness on the economy, or in some way to create a barrier to the sort of fossil fuel forward policy of this administration. So that's terrible because that is really our basis for doing the work that we're doing. And they have already acted on it. As Carolyn said, there's already been lawsuits in New York and Vermont and Michigan and Hawaii. And they're very different kinds, and I think it's like worth spending a second on it, but then there is a bit of a silver lining, and I've got a question for you guys. So in New York and Vermont, they probably know they have recently passed these sort of state Superfund laws that are basically compensation for climate damages. So, the states are really starting to see the impacts of climate change show up in state budgets. And it's hard, especially for a state like Vermont, to come up with enough money to be able to respond. The floods of 2023, if you remember them, wreaked havoc in Vermont, very, very expensive events that occurred there. And that, of course, rippled down the Connecticut River to western Massachusetts. So it's pretty real. And this basically, it's polluter pays. Everybody remembers Superfund, right? So polluter pays, by the way, still holds extremely well. So people get that if you are causing, pollution that is turning the world upside down, maybe you should pay to help clean that up. So the arguments that the administration is putting forth are the same kind of thing you would normally see, kind of like preemption or whatever. Preemption is tough for them in this spot because they're actually not regulating air emissions. So I think that one's going to be hard for them. But nevertheless, what it does, and this is the important thing to remember, just like the politics of this, the Vermont AG's office is like a teeny little office that, at least when I worked with those guys, they have 3 people. So now they have to defend against this lawsuit that's fought by the Department of Justice with all of its firepower. So that will be a big deterrent to other states looking around going, it would be good for us to have a law like that. We could use that money, but is it really the juice worth the squeeze if they're going to come after us like that? Big guns. So that's one thing. The lawsuits that are happening in Michigan and in Hawaii are part of a larger effort that's been afoot for a while. We maybe over lunch, I'll tell you the ins and outs of the Exxon litigation. But suffice to say, that complaint got filed in or around 2020. It's still being litigated. And the idea there is a consumer deception claim. You knew this stuff, and of course we know that from Inside Climate News reporting and the LA Times reporting and all the other documents that have now come through. This is not an issue. You knew this stuff, and you didn't tell your consumers about it. And maybe if you had, people might have made different decisions about the products they wish they purchased or the investments that they wanted to make. Our state, these are UDAP statutes, unfair deceptive acting practices statutes. Every state in the country has them, and they're basically like our lemon laws. You can't deceive consumers, and ours covers investors. So those have gained a lot of steam. We were one of the first states out of the gate with it. We were, I think, the first state to use 93A, our state UDAP statute. And there have since been lots of efforts in Congress to pass liability shields that, like the, I don't know if somebody in the room will remember, but like the gun manufacturer's liability shield that was passed about 10 years ago. So the idea would be it would insulate fossil fuel companies 101% across the board for any of these claims by states or private plaintiffs. And of course, we expect to see and have seen a real increase. I mean, there have been litigations now from crab fishermen in the Pacific and whatnot. And if you are very interested in this, you should follow Amy Westervelt's podcast from start to finish, because it gives you a really good overview of the history of these litigations. And also Arnold and Porter has a climate case tracker that I think lives at NYU now, gives you a sense of like all of these climate cases. So that is one effort that's been happening at the congressional level, and then you see with this executive order and what DOJ has done is now it's gone after these two states for the litigation they are trying to bring. And again, preemption, federal officer, like all of the things, which have already been litigated, by the way, most of them up to the appeals court. So it's troubling because it takes state resources to defend against them. But does anybody remember the basis for most of these state clean energy laws, the constitutional basis? Anybody want to hazard a guess? What do states like?
Reserve powers.
Their police powers. Their police powers. Why else do states like to exercise their police powers?
Public health and safety.
Public health and safety. So when states are moving forward with anti-choice provisions, they are largely doing that on the basis of their police powers. So you begin to see where it's going to get very dicey for some of the people who want to rely on their police powers to continue to regulate women's access to health care, to also take the same position that other states shouldn't use that same power to ensure that their citizens' health is protected from the impact of climate change. So, did you guys read the pork producers case? Do you know this case?
Yeah.
Go, Carly, just go ahead.
I think that was a dormant commerce clause case, and it was about whether or not a state regulating the conditions under which pork is manufactured that effect on other states' farmers, whether that was constitutional or not.
Brilliant. And so ultimately, the Biden administration changed sides in that case and decided to come in on the side of California, which was, as we just heard, regulating the amount of space that female pigs can have to be more humane. And the reason for that was because we thought that was good policy. We also thought it's really important for states to be able to exercise their police power to have clean energy regulations. And we knew that now Justice Gorsuch had decided a similar case upholding the constitutionality of Colorado's RPS standards to a dormant commerce clause challenge just a few years before. And so we also knew that the court would probably be disinclined to find that states cannot exercise their police powers in this way. So I just share this sort of three-dimensional chess with you a little bit as lawyers, because sometimes it looks like, oh, this is terrible, and there's no way around it. But then you start to think about the interests at stake and how to craft your arguments in a way that will make people uncomfortable with the legal positions that they are taking.
Thank you so much. And Commissioner, I'm sorry, we're running out of time, and I want to make sure that we have a chance for our audience to ask some questions, hopefully particularly to the Commissioner. So does anyone have any questions from our audience? Yes.
I have a question.
Sorry.
Sorry, we're going to pause for a second because we have a robust audience on Zoom, so we want everybody to please use the mic. So thank you.
Well, I want to thank all of you for all that you're doing. I'm very impressed. But it seems to me the challenge for environment a little not easier. The financing part of it seems to be something that can augment the state contribution. Whereas to me, I feel badly for the Commissioner of Insurance, because yours seems to be very challenging in terms of the money part of it, and yet so critical in our state, and I'm sure it's the same for the Department of Public Health. What are some of the, if there are any ways to deal with the financing in similar ways to what's being done in the environmental area?
I think you're right, it is very challenging. I think we're also in a position where Massachusetts will end up being leaders on the topic. There's not a lot of examples of what to do here. I also think the impact of elections matter. And what we're talking about here is fundamental change that will really be amplified in a new presidential administration. Much of the healthcare financing structure for Massachusetts and every state is subject to federal approval through I think as a fundamental aspect to this change that we talked about for paying for performance, we'll end up having to draft a new waiver application for an administration that would be receptive to that. That work should happen now on the ground so that when it's ready to be launched, depending on the implications of elections and who's in charge and when, we can not have to wait again for another few years. We can actually activate on it. So I call myself a brutal or a persistent optimist. I actually think there's a lot of room for optimism here. The level of change, the urgency of the need for change is so high that I think we'll end up having to affect consequential change.
I can add from the public health perspective, perhaps, a micro-analysis and then macro-analysis of this problem. The micro-analysis being that if you look at states across the country, there's a blend of how those are funded through state resources and federal resources. And the range is quite significant. There are some states that have 95% of their support coming from the federal government. Those are states like Alabama, Mississippi, Texas, Florida, even some states up here in the Northeast, New Hampshire, where they have 90% of their total funding coming from the federal government. Even blue states like Connecticut, 80% of their funding for public health across all of their programming comes from the federal government. Whereas here in Massachusetts, it's about 50%. And so we have a little bit of flexibility in our budget and in our ability to get money out the door because we have such a strong state resource to do so. And that's not just looking at the Department of Public Health budget, it's really looking at public health programming across the federal government and the state government system. So that's sort of in a micro evaluation how we're thinking about the financing. I think when we look more broadly, in some ways I want to be a brutal optimist as well, but this is a little bit more of a cynical perspective here. What I worry about is that we start to look at what happens when the Medicare and Medicaid program starts to pull back on its financing. What happens when the Affordable Care Act provisions go away, when Medicaid expansion is no longer available, when there's no longer subsidies for folks who are on connector plans? What happens is that people no longer have access to health insurance, or their health insurance doesn't go far enough. And the next answer is that there has to be a safety net underneath those safety nets. And I've begun to describe public health and the work of state public health really as the safety net to the safety net. When folks can't go to a community health center because the federal government has said undocumented individuals are no longer covered at federally qualified community health centers, those individuals still need vaccines, they still need prenatal visits, they still need folks coming into their home to check their blood pressure, and the people that are going to do that are public health workers in the public health departments. And so we're trying to think through, given the resources we have and given what we see coming down from the federal government, how are we going to support that safety net underneath the safety net?
Other questions? Yeah, in the back.
Commissioner, you talked about getting or making primary care more accessible for people to, I guess, get them to use that instead of more expensive things of care. After you've solved the funding issue, how do you achieve the behavior change now that people have gotten used to faster but more expensive methods?
Yeah, it's a great question. I actually think the dollar flow matters to the patient too, so we have to make it consequential to the individual to make it easier for them to go see a primary care doctor. So things like zero copay. You go see your primary care doctor for a routine visit, not just your annual visit, which is already supposed to be zero cost share, although a lot of people don't know that. So it's supposed to be zero when you go in for your annual physical. But every appointment with your primary care doctor could be motivated by a zero copay. We should want that. We should have your primary care doctor be your quarterback, or that office be the quarterback for your care. And we should align the insurance contract that they have with the theory, the philosophy behind getting that care at the primary care office.
Other questions from students?
Sorry, I'm going to read out a question that was sent to me by text from our Zoom viewers. I guess the way to maybe make this question a little bit shorter and more targeted is, what do you see as a trade-off between national uniformity and state policy making that might be more specific to the locality or the culture? There's a variety of different examples that were given in this question, but I think that sort of sets it up well for all three of you to respond.
I'm happy to start. I guess probably the best example I can think of there is to think about measles, right? You can't pick up a newspaper now and not read about measles outbreaks that are happening across the country. So we're seeing what happens when there's a lack of uniformity in recommendations and in the strength of the recommendations, right? One could say a measles outbreak in West Texas, how is that going to affect us here in Massachusetts? Well, it has dramatic effects on us here in Massachusetts. First, we know that it went from West Texas to New Mexico to Oklahoma into Mexico, so it's starting to spread regionally in that area. It is linked to the outbreak that's happening in South Carolina. So a case from West Texas eventually made its way over to South Carolina. And we know that those individuals are going into airports. Those airports are connected to Logan. People are coming up here. Right? So as soon as you start to have a fracturing of state recommendations around vaccination requirements, whether that be what we say to our schools, or how strongly a public health leader can come out and talk about the benefits of vaccination, we put the entire nation at risk. That is why it was, as I described earlier, so important that we formed this collaborative across the Northeast and now into the Mid-Atlantic. Because all of us recognize that it really doesn't matter the politics of the individuals in our states. What matters is that it's super simple to drive between Rhode Island, Connecticut, and Massachusetts during your lunch break. Right? You can get to all three of those states. So if we don't have aligned policies, if we don't have aligned vaccine recommendations, we are all at risk.
There used to be this idea in environmental law and policy in the United States of cooperative federalism, but that is largely a bygone value, I think. I think that this is a great question because there are really reasonable positions on both sides of it. You know, having represented regulated entities for many years in private practice, it is challenging at times to be obligated to comply with, if you're a business that, has operations in multiple states, and then you are then obligated to comply with multiple state environmental laws that are quite different. That is a administrative cost, that is a challenge, there's some real legitimacy to that position. On the other hand, if you think about an issue like climate change that has just been so politically charged, if it weren't for the states, we still don't have federal regulation of greenhouse gas pollutants. And even though we had some of the things that are now going away, it really wasn't ever economy-wide and as robust as it needed to be. Waxman Markey is the closest we came to having a federal statute in that space, and we can get it over the hump. So it's really important that we had state laws that are coming to the fore to address that issue and giving the model and sending the market signals. And you've got broad adoption of energy efficient standards, broad adoption of renewable portfolio standards in states that are red states and blue states. So that is super important. And then I think too, just stepping out of the climate space, if you think about wetlands protection and Clean Water Act protection, this is not new to this convention because it's been happening in these parts of trying to deregulate protection, particularly of wetlands, which are extremely important for biodiversity, for fisheries. For our multi-billion-dollar fishery here in the Northeast, very important to have these habitats, and also extremely important from a carbon sequestration standpoint. And now through the WOTUS rule that is now either final or neo-final, I can't keep track of how many versions of it we've had, it functionally strips away all of the protection for wetlands. Massachusetts has one of the most protective state wetlands laws, and that's very important because we have a biodiversity priority. we're seeking to be 30% by 30 protected, and that includes marine environments. So if it weren't for our state statute, we wouldn't be able to do that. So I think ultimately where I come down on is it's been very beneficial, but I can see the counter arguments.
I would just add, I think uniquely climate, health, and insurance are areas where there's been regionalization for a number of years. And I think one of the things that we're seeing is a need to broaden that scope to other policy areas, not just the ones that we've worked on and historically have always had some level of regional greenhouse gas initiatives, for example, or regional health initiatives. But putting that, amplifying that a little bit more. Let's be clear though, there are certain things that the federal government should have the primary role on if they were to fulfill the promise of having an educated and enlightened view of issues. In states, we can do what we can do. Let's be very clear, we're trying our best here. But there are certain issues where there's a default on the obligation to act. And luckily, we have, there's terms and things change. And people can change their priorities by voting. But there is no substitute for the federal government in many of these areas.
We have time for one more question.
Thank you all so much for being here today to talk to us. So my question relates to what Mike was just saying, actually, in terms of what are the challenges in lack of like a federal ASIP or like a body that is telling you what to do and what to say? Like have there been any efforts at the national level in terms of vaccines other than the Northeast Coalition to like rally people, and like who are the holdouts, would you say? Or like who are you running into?
Yeah, I think I have two answers to that question. So first to talk about what are the challenges. It turns out the challenges are sort of uniquely in the blue states. They're uniquely in states that have had a history of Democratic leadership that has interwoven federal policy into state policy. So here in Massachusetts, we had many examples in our statute where we pointed to the Advisory Committee on Immunization Practices and we said, that is where we should be looking. And red states didn't do that. So Texas and Arkansas and Mississippi and Alabama, they do not have ACIP in their statute or in their regulatory scheme. They always wanted to have the state make the decisions. So there's something sort of unique that's happening right now where blue states are learning from red states, and we're trying to figure out how do we model our policies off of yours and the sort of state leadership that they have had for some time. That said, we still, I think even those of us who are in blue states and those of us who are in red states, want some sort of national guidance, because it is very challenging to analyze all of the data that are coming out, to understand those data in the context of how society works and who will receive a vaccine, who won't, when do you need it, all of those pieces. And there have been some efforts of folks who have tried to stand up a national perspective on this. The Vaccine Integrity Project is one of those. It's run out of Minnesota, out of CIDREP, which is the Center for Infectious Disease Response, Analysis and Policy, I think is what those letters are. But it's a really wonderful sort of nonprofit associated with the university that has done a lot of the data analysis, has tried to bring people together. Common Health Coalition is another group that has brought together healthcare providers, insurers, and public health to try to get everyone on the same page. So we're starting to see these groups come forward and move out with their recommendations. And it's still it's very challenging because the Advisory Committee on Immunization Practices has been around for over 50 years. We all are just conditioned to listen to what they have to say.
First of all, on behalf of the Rappaport Center, the Rappaport Foundation, and BC Law, we just really want to thank Professors Cox and Hashimoto for moderating this incredible panel today. Mike Caujo, you are really an excellent board chair. I really appreciated that promo for state and local policy. And as effective as your promotion was, I actually think that the three of you here today are actually the best, both advocates and models of why state and local policy work really matters and is really meaningful. And so I'm really, really grateful for that, and I know the students here and as well watching on Zoom are as well. I've been thinking a lot in recent days about a quote that I've heard from Amanda Gorman, where she says that our hardest change hinges on our darkest challenges, and especially when I hear Chief Hoffer with your incredible optimism, despite everything that is going on in the world. I think about how important it is to have incredible public servants like the three of you, who are able to see really bright opportunities in these really dark moments, and then to make real some changes, and that are to the vast improvement of all of us who are here in Massachusetts. And so for that, we are really grateful for the three of you, your teams, and also for your generosity in sharing your insights with us and everybody on Zoom here today. So thank you all. Thank you to everybody who attended. We look forward to seeing you at the next Rappaport event in April.